Sulphonamides. History and the development of the sulphonamides. Antibacterial sulphonamides. Sulphonamide was firstly noted as antibacterial in 1900s by Gerhard Domach, a Nobel Prize winner in 1939. In his attempt to save his daughter from streptococci-killing infection, he observed that prontosil, a sulphonamide dye, is able to selectively restrain the infectious bacteria cells. In 1936, Ernest Fourneau found out prontosil pathway in human body. He discovered that this dye was a prodrug. It actually changes in human body to sulfonilamide, which is the antibacterial active agent. This invention triggered the discoveries of other antibacterial members derived from this chemical group, such as sulfapyridine in 1938 against pneumonia, and sulfacetamide in 1941 against urinary tract infections, and succinyl sulfathiazole in 1942 against gastrointestinal tract infections. Sulfathiazole was commonly used during World War II to cure soldier wounds infections. On the contrary, sulfonilamide was not very used due to its greater human toxicity. Later on, sulfasoxide, sulfamethoxysol, sulfacetamide, mefenide and sulfadiazine silver were discovered, and those four agents are the sulfonamide antibacterial agents have been in the clinical use so far. Anti-hyperglycemic agents. In 1950s, carbutamide, 1-butyl-3-sulfonylurea, was the first sulfonylurea compound presented in the clinical use for diabetes therapy, but not for too long as it had adverse effects on bone marrow. In 1956, Germany introduced tolbutamide, sulfadrugs derivative, as the first sulfonylurea compound to be in clinical use for diabetes treatment. Other first-generation sulfonylurea compounds, acetoxamide, tolazamide, and chloropropamide were available in the German market. Glyburide and glipizide, more potent sulfonylurea members, entered the U.S. drug market in 1984, after more than a decade of their usage in Europe. Furthermore, glimepiride, the most potent sulfonylurea compound, was not commercially introduced till 1995 in the U.S. drug market. As diuretics. In general, diuretics such as carbonic anhydrase inhibitors, shift Kn to extracellular, thiazides, inhibit the Na plus Cl reabsorption, and loop diuretics, inhibit the Na plus Cl, Kn reabsorption, are sulfonamide compounds. Loop diuretics are considered safer and high-ceiling diuretics. Their efficacy has linear relationship with their doses, to the contrary of thiazides, which are low-ceiling diuretics. These properties can be attributed to the reason that the loop diuretics are sulfonamide derivatives, not thiazide ones. Anti-inflammatory agents. Celecoxib, rofecoxib, and valdecoxib are sulfonamide derivative, work as anti-inflammatory agents. Their mechanism of action is selectively inhibiting cyclooxygenase 2 enzyme, COX-2 enzymes, arachidonic acid to prostaglandins. Other pharmacological sulfonamide compounds. These include protease inhibitors with activity against human immunodeficiency virus type 1, HIV-1, such as amprenavir and fosamaprinavar, anticonvulsant agent used in the treatment of epilepsy and migraine such as topiramate, block sodium and calcium channels, antihypertension as sotalol, potassium current blocking, anti-inflammatory and immunosuppressive agent with antibacterial and antibiotic properties such as dapsone, antiarrhythmia agent as ibutylide, a uricose uric and renal. Tubular blocking agent, probenecid, which is used to treat chronic gouty arthritis, and anti-seizure such as zonisamide, block the sodium and potassium channels. SAR of sulfonamides. The major features of SAR of sulfonamides include the following. Sulfonilamide skeleton is the minimum structural requirement for antibacterial activity. The amino and sulfonyl groups on the benzene ring are essential and should be in 1 and 4 position. The N4 amino group could be modified to be prodrugs, which are converted to free amino function in vivo. Sulfur atom should be directly linked to the benzene ring. Replacement of benzene ring by other ring systems or the introduction of additional substituents on it decreases or abolishes its activity. Exchange of the SO2NH group by CONH reduces the activity. On N1 substituted sulfonamides, activity varies with the nature of the substituent at the amino group. With substituents imparting electron-rich characters to SO2 group, bacteriostatic activity increases. Heterocyclic substituents lead to highly potent derivatives, while sulfonamides, which contain a single benzene ring at N1 position, are considerably more toxic than heterocyclic ring analogues. The free aromatic amino groups should reside para to the sulfonamide group. Its replacement at ortho or meta position results in compounds devoid of antibacterial activity. The active form of sulfonamide is the ionized, maximum activity that is observed between the pKa values 6.6–7.4. Substitutions in the benzene ring of sulfonamides produced inactive compounds. Substitution of free sulfonic acid, SO3H, group for sulfonamido function destroys the activity, but replacement by a sulfonic acid group, SO2H, and acetylation of N4 position retains back the activity. Metasulfonamides bind to the basic centers of arginine, histidine, and lysine sites of proteins. The binding groups are alkyl, alkazine, and halides. The binding affects the activity of sulfonamides. Protein binding appears to modulate the availability of the drug and its half-life. The lipid solubility influences the pharmacokinetic and antibacterial activity, and so increases the half-life and antibacterial activity in vitro. Sulfonamides can be classified in various ways. 1. On the basis of the site of action. I. Sulfonamides for general infection, sulfonilamide, sulfapyridine, sulfadiazine, sulfamethoxycin, sulfamethoxazole. 2. Sulfonamides for urinary tract infections, sulfazoxazole, sulfathiazole. 3. Sulfonamides for intestinal infections, thallylsulfathiazole, succinylsulfathiazole, sulfasalazine. 4. Sulfonamides for local infections, sulpocicetamide, mefenamide, silver sulfadiazine. V. Sulfonamides for dermatitis, dapsone, solapsone. 6. Sulfonamides in combination, trimethoprim with sulfamethoxazole. 2. On the basis of the pharmacokinetic properties. I. Poorly absorbed sulfonamides, locally acting sulfonamides sulfasalazine, thallylsulfathiazole, sulfaguanidine, salicylazosulfapyridine, succinylsulfathiazole. 2. Rapidly absorbed and rapidly excreted, systemic sulfonamides sulfamethoxazole, sulfazoxazole, sulfadiazine, sulfatamidine, sulfafurazole, sulfasamidine, sulfamethiazole, sulfacetamide sulfachlorpyridazine. 3. Topically used sulfonamides, sulfacetamide, mefenide, sulfathiazole, silver sulfadiazine. 3. On the basis of the pharmacological activity. 4. On the basis of the duration of action. I. Extra long-acting sulfonamides, half-life greater than 50 H sulfasalazine, sulfaclamide, sulfaline. 2. Long-acting sulfonamides, half-life greater than 24 H sulfadoxine, sulfadimethoxine, sulfamethoxypyridazine, sulfamethoxydiazine, sulfafenazole, sulfamethoxine. 3. Intermediate acting sulfonamides, half-life between 10–24 H sulfasamizole, sulfamethoxazole. 4. Short-acting sulfonamides, half-life less than 20 H sulfamethiazole, sulfazoxazole. V. Injectable, soluble sulfadrugs sulfafurazole, sulfadiazine, sulfamethoxine. 5. On the basis of the chemical structure. I. N1 substituted sulfonamide, sulfadiazine, sulfacetamide, sulfatamidine. 2. N4 substituted sulfonamides, prodrugs prontosil. 3. Both N1 and N4 substituted sulfonamides, succinylsulfathiazole, thallylsulfathiazole. 4. Miscellaneous, mefenide sodium. Structures of sulfonamide derivatives. Mechanism of action. Animals, including humans, cannot synthesize folate and therefore must obtain folate from their diet. All plants and fungi and certain protozoa, bacteria, and archaea can synthesize folate de novo through variations on the same biosynthetic pathway. The folate molecule is synthesized from pterin pyrophosphate and para-aminobenzoic acid through the action of dihydrofolate synthase. Pterin is in turn derived in a series of enzymatically catalyzed steps from guanosine triphosphate, GTP, while para-aminobenzoic acid, vitamin B10, is a product of the shikimate pathway. Folic acid is a vitamin that helps make DNA and red blood cells. A person has to ingest folic acid through their diet or supplements because the body cannot make it. On the other hand, bacteria can make their own folic acid, which it uses to multiply and grow more bacteria. A sulphonamide interferes with the ability of bacteria to use folic acid to grow by stopping the metabolic process. Therefore, the bacteria are unable to reproduce. Sulphonamide is considered a bacteriostatic because it's able to stop bacteria growth, but it isn't able to kill the bacteria. The white blood cells in the body are usually able to do that. Sometimes a different type of antibiotic is used along with a sulphonamide called trimethoprim. Trimethoprim is a bactericidal because it's able to kill the bacteria. The combination of the medications stops bacteria from multiplying and destroys them as well. Sulfamethizole. Mechanism of action. Sulfamethizole is a competitive inhibitor of bacterial enzyme dihydroaptate synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid. Kinetics. Sulfamethizole is readily absorbed from the GI tract. Distributed into most body tissues but does not appear to diffuse into the CSF of patients with normal meninges. Sulfamethizole is approximately 90% bound to plasma proteins. Since the drug is rapidly eliminated in urine, the manufacturer states that accumulation of sulfamethizole in tissues outside the urinary tract is minimal. Side effects. As in all sulfonamide therapy, the following reactions may occur: nausea, vomiting, diarrhea, hepatitis, pancreatitis, blood dyscrasias, neuropathy, drug fever, skin rash, petechiae, purpura, hematuria and crystalluria. Uses. Sulfamethizole is a sulfonamide antibiotic. The sulfonamides are synthetic bacteriostatic antibiotics with a wide spectrum against most gram-positive and many gram-negative organisms. Mainly used in the treatment of urinary tract infections. Sulfoxazole. Mechanism: competitive inhibitor of the enzyme dihydroaptate synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid. Kinetics. Sulfoxazole is absorbed more rapidly, attaining earlier peak values that are 50% higher than those of sulfadiazine. Sulfoxazole and its acetylated metabolites are excreted primarily by the kidneys through glomerular filtration. The serum half-life is 10–12 hours. Side effects. Dermatitis, rash, pruritus, photosensitivity, agranulocytosis, leukopenia, thrombocytopenia, aplastic anemia, purpura. Genitourinary side effects have included crystalluria, hematuria, and urinary retention, nausea, emesis, anorexia, abdominal pain, diarrhea, gastrointestinal hemorrhage, melena, flatulence, glossitis, stomatitis, enlarged salivary gland, and pancreatitis. Uses. Sulfoxazole is a sulfonamide, sulfa, antibiotic that helps keep bacteria from growing in your body. Sulfoxazole is used to treat or prevent many different types of infections caused by bacteria, such as bladder infections, ear infections, or meningitis. Sulfacetamide. Mechanism. Competitive inhibitor of bacterial enzyme dihydroaptate synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid. Kinetics. The oral absorption of sulfacetamide is found to be 100% and the plasma protein binding is 80–85%. In the liver it is metabolized to inactive metabolites. Plasma half-life is 7–12.8 hours. It is excreted primarily in the urine. Secretory routes of less significance are bile, feces, milk, and sweat. Glomerular filtration, active tubular secretion, and tubular reabsorption are the main processes involved. Side effects. The most common side effects are irritation, stinging or burning of the skin. Other side effects include nausea, vomiting, dizziness, tiredness and headache. Severe side effects including severe allergic reactions, like nettle, rash, itch, tightness in chest, difficult breathing, and swelling in either the face, mouth, lips or tongue. Other severe side effects include bloody or severe diarrhea, fever, joint pain, red, blistered or swollen skin and stomach pain. Uses. This medication is used to treat bacterial eye infections, such as conjunctivitis. It belongs to a class of drugs known as sulfa-antibiotics. Sulfacetamide works by stopping the growth of bacteria. Sulfacetamide sodium is an antibiotic that fights bacteria on the skin. Sulfacetamide sodium topical, for the skin, is used to treat acne, dandruff, seborrheic dermatitis, red, flaking skin rash, and certain skin infections. Sulfapyridine. Mechanism. Sulfapyridine is a competitive inhibitor of the bacterial enzyme dihydroapatase synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid by means of processing the substrate para-aminobenzoic acid, PABA. Dihydroapatase synthetase activity is vital in the synthesis of folate, and folate is required for cells to make nucleic acids, such as DNA or RNA. So if DNA molecules cannot be built, the cell cannot divide. Kinetics. Sulfapyridine is completely absorbed orally and undergoes acetylation, hydroxylation, and glucuronidation in the liver. The sulphonamides are widely distributed throughout all tissues. A mix of unchanged, hydroxylated, and glucuronidate sulfapyridine is eliminated in urine. Side effects. Fever, headache, continuing, itching, skin rash, aching of joints and muscles, difficulty in swallowing, pale skin, redness, blistering, peeling, or loosening of skin, sore throat, unusual bleeding or bruising, unusual tiredness or weakness, yellow eyes or skin. Uses. Sulfapyridine is a sulfamedicine. It is used to help control dermatitis herpetiformis, During's disease, a skin problem. Sulfamethoxazole. Mechanism. Competitive inhibitor of bacterial enzyme dihydroapatase synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid. Kinetics. Rapidly absorbed following oral administration. Also well absorbed topically. Sulfamethoxazole is widely distributed into most body tissues. Sulfamethoxazole crosses the placenta. The metabolism of sulfamethoxazole occurs predominantly by N4-acetylation, although the glucuronide conjugate has been identified. The N4-acetyl metabolites, which do not possess antibacterial activity, eliminate through the urine. Side effects. Anorexia, colic, nausea, vomiting, dizziness, headache, drowsiness, and unconsciousness. Less common symptoms may include pyrexia, hematuria, and crystalluria. Uses. Sulfamethoxazole is indicated in combination with trimethoprim, in various formulations, for the following infections caused by bacteria with documented susceptibility: urinary tract infections, acute otitis media in pediatric patients, when clinically indicated, acute exacerbations of chronic bronchitis in adults, enteritis caused by susceptible Shigella, prophylaxis and treatment of pneumocystis jirovecii pneumonia, and traveler's diarrhea caused by enterotoxigenic E. coli. Sulfadiazine. Mechanism. Inhibitor of bacterial of the enzyme dihydroapatase synthetase. The inhibited reaction is necessary in these organisms for the synthesis of folic acid. Kinetics. The chemical is poorly soluble, and has only very limited penetration through intact skin. However, contact with body fluids produces free sulfadiazine, which can then be systemically absorbed and distributed. It undergoes glucuronidation in the liver and is also excreted unaltered in urine. Side effects. Side effects reported for sulfadiazine include nausea, loss of appetite, and dizziness, cell death of the skin, localized eruption of the skin, transient skin discoloration. Uses: commonly used to treat urinary tract infections and burns. In combination, sulfadiazine and pyrimethamine can be used to treat toxoplasmosis, the disease caused by Toxoplasma gondii. It is a second-line treatment for otitis media, prevention of rheumatic fever, chancroid, chlamydia. Mefenide acetate. Mechanism. The precise mechanism of mefenide is unknown. However, mefenide reduces the bacterial population in the avascular burn tissue and promotes spontaneous healing of deep burns. Kinetics. Mefenide is absorbed through devascularized areas into the systemic circulation following topical administration. Approximately 80% of a mefenide acetate dose is delivered to burn tissue over 4 hours following topical application of the 5% solution. Following application of mefenide acetate cream and solution, peak mefenide concentrations in human burn skin tissue occur at 2 and 4 hours, respectively. Peak tissue concentrations are similar following administration of the solution or cream. Renal metabolite rapidly excreted in urine in high concentrations. However, the parent compound has not been detected in urine. Side effects. Adverse reactions can include superinfection, pain or burning upon application, rash, pruritus, tachypnea, or hyperventilation. Mefenide is metabolized to a carbonic anhydrase inhibitor, which could potentially result in metabolic acidosis. Uses: 5% topical solution is indicated for use as an adjunctive topical antimicrobial agent to control bacterial infection when used under moist dressings over meshed autografts on excised burn wounds. Sulfasalazine. Mechanism. Actual mechanism is not known. But it appears that sulfasalazine and its metabolites have immunosuppressive, antibacterial, and anti-inflammatory effects. It also appears to inhibit the cysteine glutamate antiporter. Kinetics. Around 90% of a dose of sulfasalazine reaches the colon, where most of it is metabolized by bacteria into sulfapyridine and mesalazine. Both metabolites are active. Most of the sulfapyridine is absorbed and then further metabolized, but most mesalazine is not, and remains in the colon. A mix of unchanged, hydroxylated, and glucuronidate sulfapyridine is eliminated in urine, as is acetylated mesalazine and unmetabolized sulfasalazine. Side effects. Sulfasalazine is contraindicated in people with sulfa allergies and in those with urinary tract obstructions, intestinal obstructions, and severe liver or kidney problems. In rare cases, sulfasalazine can cause severe depression in young males. It can also cause oligospermia and temporary infertility. Immune thrombocytopenia has been reported. Sulfasalazine may cause stomach upset, nausea, vomiting, loss of appetite, headache, dizziness, or unusual tiredness. Uses: sulfasalazine is used in the treatment of inflammatory bowel disease, including ulcerative colitis and Crohn's disease. It is also indicated for use in rheumatoid arthritis and used in other types of inflammatory arthritis.
Thank you for watching video and subscribe for more.